Hi, everyone, and welcome. We're going to wait a few seconds before we start, but thank you so much for joining us today. My name is YH. I'm a senior product marketing manager at AliaCare. I'm very excited to be your moderator today for this roundtable, building an efficient and compliant back office in home-based care. So with this, let me start by quickly introducing AliaCare for those of you who may not be familiar with us. So AliaCare Cloud is an EMR platform with built-in AI capabilities. So essentially, we are the operating system for home-based care, supporting operators with the entire client lifecycle. That is from intake and assessment to care planning and delivery, scheduling and visit optimization, and of course, EVV and revenue cycle management. So our focus is to help agencies like yours operate more efficiently so you can focus on care quality and scaling your impact within your communities. So, today we're having this conversation as federal and state level scrutiny on Medicaid has skyrocketed with the HR1 bill, known as the Big Beautiful Bill, introduced by President Trump, and also the anti fraud task force led by Vice President J.D. Vance. We're seeing a massive trickle down effect across the country. Because of this federal pressure, program integrity has become a top priority for every single state, and to gain greater confidence around how every dollar is spent. At the front and center of it is the Medicaid programs. So we're seeing tighter partnership between state Medicaid agencies and the Office of Inspector General. We're seeing that they're no longer waiting on whistleblower complaints. Instead, they are heavily equipped with advanced data analytics and AI technology. They're actively scanning for outliers, unusual utilization patterns, and high-risk billing behaviors. So often, what we're seeing is freezing payments first and then investigating later. And states are being forced to crack down or risk losing their federal funding. So on this, some of the enforcement environment, what we're seeing has shifted. So these are a few examples of reinforcement at the state level that have happened in the last 90 days. So as you can see, this is quite a bit of movement recently. And all this broader national trend does impact how your operational and compliance story uh, pans out. So it directly shapes your payment, your risk profile, and your ability to grow. And behind every visit, every caregiver schedule, and every claim, there's a back office team trying to keep up with this reality, often with manual workarounds, disconnected systems, and processes that depend on tribal knowledge. So the main question we'll try to answer today with this panel is what does a high functioning, efficient, and audit ready back office actually look like? And how can we get there in practical steps? So, without further ado, we're joined by an excellent panel of compliance and operation leaders who live this every day. So, first we have Brent Flack Davison. Brent is a healthcare operations and transformation leader with over 15 years of experience in the healthcare sector. At the beginning of this year, he joined AliaCare as director of strategic sales after 13-year tenure at VNS Health, where he worked on industry-leading initiatives focused on value-based care and innovation across provider and health plans. Um, so we are also joined by Stephanie Mullis, who serves as Chief Compliance Officer at Vitasia Healthcare Consultants. With 15 years of executive leadership and nearly 2 decades in healthcare, she leads compliance, quality assurance, and process improvements across Vitasia's 5 operating agencies. Vitasia's agencies have expanded rapidly, growing 4 times in the past year alone. Next, we have Maya Esposito. Maya is a compliance leader specializing in home and community-based care, currently serving as Vice President of Compliance at Valence Care, where she leads compliance strategy for a family of home health agencies. She brings more than 11 years of experience spanning compliance, legal operations, privacy, and healthcare services. Before joining Valence Care, Maya held leadership roles at Galileo and VNS Health, where she led compliance, privacy, legal operations initiatives across home care, hospice, health plans, behavioral health, and digital first care models. And finally, we have Michelle Pickering. Michelle is a healthcare operator and advisor with 20 plus years of experience across post-acute care, hospice, home care, and healthcare services. As a COO at Momentum Healthcare and Technology Consulting, she leads operational strategy and execution for organizations navigating growth, transformations, and mergers and acquisitions. She partners with providers, investors, and technology companies to drive sustainable growth while maintaining high quality patient care. So, very excited to have this group with us. I'm looking forward to kickstart this conversation where we'll explore where the back office pressure is showing up, where the efficiency and compliance usually breaks down, where strong standardized workflows look like in the real world, and how technology can support better processes across um, the back office without adding complexity. And finally, concrete moves you can make in the next 90 days to reduce risks, protect margins, and make life easier for your team. So now let's get started with a first poll question. You'll see this on your screen. And with this first question, which is, which statement is the closest to your reality today? You can select one of the following answers. Take a few seconds and we'll take a look at the results together. So I see that almost half of the attendees have voted that compliance is a strategic lever for growth and profitability, whereas about 65%, 55%, sorry, are mentioning that it's either help protect margins by reducing denials and rework, help avoid risk but does not improve margins, and 6% who answered that compliance feels like overhead. So, with this, like, let's start with the first section of our conversation. What we're hearing across market is that back office pressure is coming from every direction at once. Providers are managing more payer requirements, more state by state variation, lower reimbursement rates, greater documentation scrutiny, and teams are being asked to do more with limited staff and fragmented system. So in that context in mind, let's bring in the panel. Stephanie, let's start with you. From a compliance standpoint, where do home-based care organizations more or most often get exposed today?
Hi, thank you, Wyatt. Great question. I would say the most exposure we often see is through service documentation and supporting the regulatory obligations and the claims data. Um, that can come from our field staff that do supervisory visits, completing them correctly, accurately, timely. But more often than not, it is going to be the documentation from our caregivers. It not being exactly what we need, it not being consistent. We rely on a lot of technology for that, and we rely on that in order to justify the claims that we submit. When I think of exposure, the word in itself, I think a lot of our industry exposure happen until a claim is submitted, essentially, right? So if we're not billing for a service that's rendered, for the most part, we're not susceptible to exposure. Once those claims are generated, with the documentation, if the documentation doesn't support it correctly, or if it violates any type of NCO contracts or regulatory practice, then that's where the exposure comes from. So I think scrutinizing the documentation that support the claims and the supervision of those caregivers is the most important thing to look at.
Thank you, Steph. And Maya, in your experience, what pressure are compliance teams managing right now that maybe weren't as intense of a challenge even a few years ago? And is what Stephanie also like being echoed in your organization?
Yeah, I think that's a really good and relevant question to be asking ourselves that these days. There have been a lot of regulatory changes at both the federal and state level, as you mentioned, YH, earlier in the introduction. And organizations are really faced with the challenge of balancing compliance with those requirements, keeping up with the changes in the requirements, and also dealing with the realities of things like staffing shortages, challenges with maintaining a workforce that is stable enough and also has the tools that they need to avoid burnout. As we know, nurses, caregivers, these are very difficult professions, and especially in a home care setting without some of the supports that a hospital, for example, can provide. There are a lot of things that make it difficult to, as Stephanie mentioned, meet all the documentation requirements. And on top of that, of course, as a priority is delivering the quality care that we're so committed to delivering. So there is a lot of regulatory scrutiny, audits, all types of reviews, and organizations really need to find a smart way of working and an efficient way of working to be able to balance those various pressures.
Yeah, absolutely. And Michelle, when you look across agencies as part of your experience, what are the most common sign that a back office is under strain?
Yeah, I think when I'm doing an assessment of an agency, so whether that's kind of like a pre-acquisition due diligence or an operational transformation engagement, there's kind of five signals I probably look for that tell me almost immediately whether the back office is under strain. So I think first is cash, really looking at the AR aging. If an agency has more than 20 to 25% of their receivables sitting past 90 days, there's almost always a root cause problem like upstream. So that could come from incomplete intake, authorization misses, documentation errors, just anything causing those clean claim rates to drop. I think that's kind of the first thing I look at. And then second is really the rework volume, right? So the average home health agency spends somewhere between 25 and 35% of its billing team's time on rework. So resubmissions, appeals, corrections, that's not a billing problem. It's a workflow problem. And I think third is turnover in the back office itself. So, the Paraprofessional Health Care Institute puts home care worker annual turnover at 77%, so annually. But when I start seeing that high turnover in your scheduling, your billing, or your intake, that tells me the systems and processes aren't supporting the work. So people are compensating kind of for a bad workflow design. And then fourth is over reliance on what we all talk about, right? That tribal knowledge. So when the answer is something like, "How do we handle this type of authorization?" and the answer is, "Ask Sarah." That's a real liability, but it's a real reality too. So Sarah might leave, Sarah might not be there that day. And when you're looking at kind of a multi-state or a multi-payer environment, that's really just especially dangerous right now. And then I think fifth is a reactive compliance posture. So if your audits and payer reviews feel like fire drills rather than routine, the back office is probably operating on hope rather than systems. So I look at those five areas, just that AR aging, that rework, that back office turnover, that over reliance on tribal knowledge, and that reactive compliant posture are the things that I look to.
Just a follow-up question because this is so interesting. Has this changed quite a bit since like the regulatory landscape evolving so fast?
Yeah, I think that the back office is having trouble catching up. And so there are more, issues for them to deal with. And Maya and Stephanie can probably speak a little bit better than even me on this, but I think that it's increased. And so they've had to add these other areas to their workflow and they don't know them. They're not comfortable with them. And again, they've been relying on kind of this tribal knowledge of people who've been there forever doing it. And so, I think that that's actually making it more challenging for them and why the need to kind of, have a better workflow process is definitely rearing its head more than ever. But my
Yeah,
perspective on that.
no, I think that's exactly right. And in fact, some changes that are even older than a year or two, things like EVV, electronic visit verification, those requirements went into effect a while ago, but a lot of agencies are still playing catch up and still figuring out what's the best way to implement it efficiently for my organization, right? Every organization, not there's no one size fits all, but there are many tools to assist with that, and it's usually those organizations that figure it out quickest, who are the ones who are able to also show, not just say, "Yeah, we're EVV compliant," but like, here's the data. Um,
No, absolutely. And Brent, from your provider background and the tech lens, Michelle and Maya have mentioned quite a bit of back office challenges. But in your perspective, how often do those challenges become organizational wide problems?
Yeah, thank you, YH. I mean, the back office is really the foundation on which agencies run, right? So its intention is to power agencies all the way from enrollment all the way through to cash. And I think home care or personal care is a low margin business. I think owners and agencies are often very scrappy, right, just by necessity, and there haven't been necessarily the tools or the tech or the financial support to haven't always been available, put it that way. And operating models have really grown organically. And where there's process gaps or technology gaps, we've kind of like thrown more people at it. And I think with the pressures that we have right now, CMS breathing down everyone's necks, rate pressures, increased scrutiny from MCOs, that's not sustainable anymore. And Michelle said it really, really succinctly is, often small issues upstream show up symptomatically downstream, right? Then they kind of snowball. Things like when your ARR is blowing up, or claims denials, aid turnover, back office staff turnover, etc. Call center call volume just spiking, and that's because things that have broken upstream have now snowballed downstream. And it would take a sort of a fraction of the time and energy to fix them upstream. But the sort of the cruel irony is now having to spend so much time to fix them downstream kind of consumes a lot of time that would be used to fix them upstream. So, getting back office right and working efficiently is really it's easier said than done, but is really the ideal.
Yeah, so what we're hearing is that from Stephanie's perspective, like the field staff needing to be, like on point and having the proper training, all the way to the back office carrying a much heavier strategic load. This isn't just about administrative burden. It's also about managing tighter margins, if I can paraphrase you, Brent. So, in terms of the next question, the set of questions here about where efficiency and compliance break down in practice. Like for many organizations, the biggest problem don't become as major compliance failure, as mentioned. And with this, the first question for Michelle, across intake, scheduling, documentation, billing, and reporting, where do you see often unnecessary rework and bottleneck?
Yeah, thank you, IH. I think for me, I spent a lot of time on this with the agencies that I work with. So I feel like I have a pretty clear picture of where kind of that friction concentrates. I think the single highest impact bottleneck I see consistently is probably in that authorization to service gap. So agencies are losing significant revenue here and creating real compliance exposure. So authorizations aren't being tracked in a structured way. I've worked with agencies where 10 and 15% of all visits being rendered have either like expired authorizations or they're pending reauth that never gets confirmed. So by the time that hits billing, you're either writing it off or trying to fight it on an appeal. And the fight is really expensive. I think second, biggest area is probably intake incompleteness. So a referral comes in, key information's missing, right? The payer class isn't confirmed, or maybe eligibility isn't verified, or physician orders aren't secured. So every downstream workflow inherits the problem. So scheduling goes out, a caregiver shows up, EVB captures the visit, and then billing hits a wall because the intake wasn't clean. So that's rework touching 4 or 5 people before it's resolved. So again, just really workflow issues and that intake incompleteness. I think for me, the third is probably the EVB exception management. So as we know, EVB is now federally required for most Medicaid personnel care and home health services, but many agencies are sitting on exception backlogs, unverified visits piling up. So CMS ties EVB compliance directly to that FMAP reductions for states, right? And the financial pressure flows straight to the providers. And then there's reporting visibility. Or lack of reporting visibility probably is the key thing there. So just when operations, compliance, and finance are all working from different data sets, or they're running reports manually at month end, so your issues don't get resolved in real time to correct them, and then by the time somebody notices denial trend, you've got 60 days of the same error, hitting those claims. So those are really the areas I see kind of as just really unnecessary rework and those bottlenecks occurring.
Thank you, Michelle. Like piggybacking on your answer, Stephanie, like from your perspective, like is there one of those back office processes or maybe another one that creates the highest compliance risk when they're inconsistent or overtly manual?
Yeah, I think I agree with all of Michelle's points. A couple of them that stick out for me are going to be EBV related. And, tying back to my first point, when it comes to claim submissions, that's when you open up your self reliability or for extra scrutiny. For us, ideally, the caregiver will go in and clock appropriately and, fulfill all their time sheets the right way. We know that doesn't happen every time, and those visits fail. What we've noticed is having a really thorough and consistent training for the individuals that do the visit verifications. I've had instances, and then just quality assurance checks on the back end of that too. I've had instances where we onboard a new employee after 90 days and, we go and we do a 10% spot check of their EVV visits, and they're just approving everybody without a GPS. And we're like, well, wait a second, why did you do this? And it's like, oh, I was, Michelle told me that, or, Britt said it was okay. And I'm like, no, 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 no. Here's your SOP. Here's your training guy. So, being consistent with your training across any process that's manual that is going to open you up for exposure is important. We do a quarterly review of SOPs, and then we, do refreshers often. I think that helps with the inconsistencies that you'll see in the back office. Uh, Having the same set of standards across, everybody in the role is important too, and then, operations supporting that. Um, Tracking the visits as well. When I talk about visits and, tracking method as far as, cadence of supervision, every state, every waiver program that we work with has a different level of that. And when we become overly manual with that, visits get missed. When we're not doing 2 or 3 fail safes, I mean, as much as I love Ally Care and we've, used them for years, I have a few team members that are like prying spreadsheets out of their hands, and I'm like, quit using this. I let them have as a fail safe by, relying on the tech and making sure that, that if there's a manual process behind it, we have some type of tech fail-safe, or if there's a tech process that's the front end, having a manual fail-safe to make sure that those things don't get missed. There's audits that will happen in some of the states that we operate in, and if we miss one, monthly check-in, that entire month of claims is clawed back. And so, that can be a very significant issue if it's inconsistently trained on, or if it's, being tracked manually on an Excel spreadsheet. So I think that those are probably the most onboarding of clients and caregivers too. We have a lot of tech innovations that help with our onboarding process. I think that the success of the caregiver starts with that, making sure that we have every piece of documentation in order from the start. and then maintaining whatever those requirements are thereafter annually, and having a smart way of alerting that type of stuff helps, just justify that we're operating efficiently and in a compliant nature.
Thank you, Stephanie. Like those are really great points and great tips for the people that are attending. And Brent, I'll turn the question to you in terms of where do disconnected system or poor workflow design create the most operational drag?
Absolutely. Thank you. So Stephanie, you touched on some like very specific areas from an operational perspective. I think if I sort of take a sort of a 10,000-foot view of looking at an agency or an agency's operating model, I think where the impact to me and really where the operational drag is, so when you see that your admin cost is really killing your profitability because you're having to plug so many gaps with people. You're starting to build that like tribal knowledge where it's ask Sarah, right? And there's just, I think, Michelle, you mentioned like this constant fire drill, right? Every time it's like, we need a new report and everyone's running around. And then the cruel irony of that is that because we're having to throw so much, energy, time, and resources like at fixing issues, there's not the times to then fix things at source. And so it's sort of this, double cruel irony of not having the ability to fix things because you just making things work. So I think for me, that's the most tragic impact of inefficient back office is it actively stops you kind of fixing the back office.
And Maya, are there any specific points in the process where provider organizations tend to fall behind or lose visibility?
Yeah, I think one area that we could drill down into a little bit more is scheduling. So, making sure that no one is scheduled for more than the number of hours exist in a day, and things like that, where humans make mistakes all the time. There's the model of having a million schedulers who have to check zip codes and this and that and the other thing that nowadays when we have the tools and there is the technology available and being developed further to help remove that burden from teams. And not to say it's replacing our entire teams, but organizations are able to really leverage these tools as like confidence checks, and also just the ability to do the big lift or the big part of the scheduling in a more digital way that is technology driven. It makes everyone's life easier. It allows for fewer mistakes. And at the end of the day, we don't want someone to show up at a patient's home and someone else to show up at the same time, and God forbid have both people there at the same time. That's where also that efficiency from a business perspective and operational streamlining, making sure there's no duplication, there's no abnormalities that can be easily addressed early on in the process.
Yeah, absolutely. One of the key things that have been repeated by inspector generals from different states has been if you're submitting for more than 24 hours of care in a day, you're flagged automatically. So moving on to the next section, now that we have talked about efficiency, compliance, tend to break down, let's shift the gears and talk about what a stronger back office can actually look like. You should see a poll on your screen right now. With the question, where does compliance have the biggest impact on your margins and your organization? So the options that you have currently are EVV and visit verification, as mentioned by Stephanie, Michelle, as well as Maya and Brent, but also documentation and audit readiness that Stephanie mentioned, authorizations and payer requirements that Michelle had mentioned, the billing integrity and denials that Brent had mentioned, and or otherwise we don't yet measure compliance in margins terms, which is a perfectly fine answer, but also something maybe to think about. So go ahead and submit your response. We're going to give 5 more seconds. Okay, so a few people have answered EVV and visit verification, and otherwise it's pretty much even split with the rest of the answers. And there's 8% of you who mentioned we don't yet measure compliance in margin terms. So let's move on to the section where what high functioning compliant back office looks like. So Maya, let's start with you. In your view, what are the foundations of back office that is both efficient and compliant?
I think it really has to do with three main factors working well together. So there's, people, process, technology, making sure that we have people in place who understand not just the requirements, but like the spirit of those requirements, like what it is that they're there to accomplish. Because once people understand the why behind the what is it that we need to do, they tend to have more of a buy-in, and really from a cultural organizational culture perspective, it gives that sense of purpose. Like we're doing this thing because not just because we're told to, but because here's how it's protecting patients, here's how it's protecting taxpayer dollars, here's how it's protecting us too. Um, and then the processes in place, making sure that there's as few, I think that came up earlier, as few handoffs as necessary. I love the HIPAA guidance of minimum necessary in many different ways in life in general too, to some extent. But right, what is the minimum effort and handoff and opportunity for mistakes that we can reach so that the job gets done, and we can move on to really focusing on quality of care and access and things like that we really want to see improvements in. And then the technology, which is the last piece, for people to go through the streamlined processes, they have to use technology in a way that is responsible, it's safe, where also they feel like they can trust the technology, and that patients and partners of theirs are aware that technology is being used and are seeing the value in it too. So that there's kind of all those things working in concert. I think that is a really solid picture of an efficient and compliant back office operation.
No, like ownership, sense of purpose, minimization, handoffs, and technology. Like that's basically the recipe for success. And Stephanie, like as you're operating in a multi-state compliance operations, it can all get complicated pretty quickly. So, what systems or habits or framework have you put in place that have helped your organization stay aligned with changing regulations across those regions?
Yeah, thank you, H. So we operate currently, what we operate in now outside of what we're licensed in 6 states right now. Within those 6 states, we have 9 waivers and 28 different NCOs. So I think that's probably like one of the big important things is that a lot of folks might think, oh, well, the state requires me to do this, so this is all I have to do. And when you operate in a state with MCOs, those MCO contracts might go above and beyond the state regulatory practice. Every waiver is a little bit different, even if it's within the same state or tucked underneath the same Department of Community Health. So I think just having a real good foundational knowledge of what you do is terribly important and how it differs. I often say sometimes it's like the mental Olympics or gymnastics of trying to like turn your brain on and off for each waiver or each state. But A lot of what my team does is we monitor survey windows on top of what we do for just regular QA. We're constantly auditing. We're looking at, every client and caregiver record on a weekly basis, if not a daily in some states. And on top of that, when we enter survey window, which is the 30 days prior to our survey window opening, we're doing mock surveys, we're doing mock audits, and we're going in and we are, reading them the riot act if things aren't looking the right way, and putting together a plan of correction with them, and, really kind of hand holding that process so that the audit comes out well. Um, some tips and tricks. You can set up Google review alerts for keywords that impact your business. So, like for instance, I work with certain waiver in Georgia, which is ICWP. I also work with a couple of others there, but I might put a Google alert in for ICWP waiver. And so anytime something, a news broadcast or an article is written on that, I get an alert for it. I can read up on it. The other thing is just consistently looking at your portals, your software. There's banner messages, there's provider alerts that come out. Um, we've seen, especially in the last few years with the increased scrutiny, that although some regulations are reviewed quarterly or annually or by the fiscal year in June, we'll see stuff. It has fallen out of that regular cadence. You can't predict it any longer. They're making rewritten rules and changing things left and right. So like the biggest takeaway is staying close with your associations, your business partners, such as Ally Care. I have folks from your organization that text me and be like, "Hey, did you see what happened in Indiana with the regs?" And I'm like, "Yeah, we're on it, but I appreciate the shout out." So I think just having a predictive and proactive approach, you know, we have one program in Georgia that doesn't have EVB requirements, and we were on the we've been doing EVB for them though. We were on the fence of taking it away, and I was like, not the right time to take 500, 1,000 caregivers and shift them to a new program. I feel this coming. So being real predictive with what you're seeing, even if you only operate in one state, look at your surrounding states or look at states that follow the practice of other states or that, kind of fall in line shortly after, and start adapting those processes right now, because then you're ahead of the game.
Yeah, absolutely. Being proactive, and both on the alerts, but also on rolling out new programs or like workflows across the board. It's quite impressive. 26 different MCOs and all of that. So it's very impressive. Michelle, to you, I will ask: when organization starts improving, what changes do you typically see in people, processes, or governance?
Yeah, I think, from my experience, I think Maya and Stephanie both touched on kind of the most important things. But I think the first thing that visibly shifts when an agency starts getting kind of their back office right isn't technology. It's not even process documentation. It's really about accountability and ownership clarity for me, or at least what I see. So you kind of start to see people who know exactly what they're responsible for, kind of what's in their lane, what a completed task looks like, what happens if it doesn't get done. And so I know that sounds simple, but it's actually like remarkably rare in agencies that have grown quickly or gone through any kind of acquisition. So for instance, when you double in size, like in 12 months, and I work with agencies that have done exactly that, the roles get really blurry, the handoffs get really informal, and, accountability gaps, appear. Kind of like what Stephanie was talking about with, just being really proactive too, and kind of thinking that through before you double in size. But I think after ownership and after accountability probably comes the standardization of the highest risk workflows. So not everything needs to be standardized. There's always a payer specific or state specific nuance that has to flex, similar to what Stephanie was mentioning as well. But I think the core workflows, your intake checklists, your authorization tracking touch points, your EVV exception resolution, that claim scrubbing, those should have really defined steps, defined timelines, defined owners. I think the third shift I typically see is routine monitoring replacing reactive cleanup. Right. So instead of running a denial report at mid-month and scrambling, teams start running daily or weekly exception reports. And I think catching issues at day 3 versus, day 30, day 60 That's the difference between a $5,000 rework event and a 15-minute fix. And so, it's like industry data suggests right now the cost to recover a denied claim averages anywhere from like $25 to $120 per claim in appeals processing. So catching that same issue pre-submission, right, is just a fraction of that cost. So the governance piece, connecting operations, compliance, and finance to that same picture tends to come a bit later. But when it clicks, that's when kind of you really get that measurable margin improvement. And so I think that those are really the things that I look at in those areas.
Thank you, Michelle. And Brent, what workflow or system characteristics make it easier for teams to stay on top of both operations and compliance?
Yeah, thank you, YH. I mean, changing and improving technology, right? It's the hardest to change, and often has the biggest impact. But I think, Michelle, you nailed it. It's not the first thing that I would change. And actually, there's I think it's Conway's law. It's an organization's technology will reflect their culture and their communication, and that's often the first place I would start. And I would look for the same characteristics from a culture, organization culture, and communication as from a technology perspective. And even at a high level, it's like, how do companies think about compliance in the first place, right? Is it just an annoyance that needs to be checked at the end? Or is it the fundamental rules upon which your business needs to be built, right? It's very, very different ways to view the world. But thinking about the tenets of culture and technology mirroring each other, I mean, like, one is just keeping the outcomes in mind. Like, what are we ultimately trying to do here in each part of the process? What's the impact going to be on aides? What's the impact going to be on patients? So from a culture perspective, as well as a technology perspective, keeping the end in mind. I think thinking from a systematic perspective, so end to end versus just like what needs to happen in this little silo versus what are we, not only what are the outcomes you're trying to do, but thinking about things from an end to end perspective. Michelle, you touched on clear accountability and ownership. I think really, really important. So people have a clarity of what expectations are, what they should be doing, when and how. It's really important. Same from a technology perspective. And then governance. So Michelle, you also teed this up really nicely. So from a governance perspective, what are the most important things we should be looking at? When should we be looking at them, and how should we be looking at them? And getting the right blend of kind of lag and lead measures. So we're keeping an eye on outcomes, but we also have an indication of how things are happening early, so we can fix them before they snowball and show up symptomatically.
Thank you, Brent. So if I can recap this, it's basically what strong organizations seem to have in common from this conversation is that we're going back to the basics. It's clear ownership, clear expectations with clear outcomes in mind. The notion of having a strong culture, system thinking, having clear accountability as well, and visibility in order to lead towards proactivity in terms of dealing with the organizational processes, but also compliance with it in mind. So the last section of our conversation here is about the role of technology that can play. So Brent, you touched upon it quite quickly, but in terms of following up on your previous answer, what should providers look for in a platform or workflow approach if they want to reduce manual effort and improve control?
Yeah, another great question, YH. First of all, just to acknowledge that it's easy to sit on a panel and say what should be done. Running an agency is so much harder, and especially I think home care, personal care is one of the hardest sectors. I think for a long time we haven't had the tools, we haven't had the reimbursement that a lot of the other sectors have had. So just firstly, just want to honor all the operators on the call for sure. We can't do it all, right? And so this is often it's about prioritization. And so understanding what's most important to your business, what the gaps are, or where are the pain points, and then understanding what the root causes are, right? So what is breaking upstream that's showing up downstream. First of all, are they critical issues that need to be fixed that could shut down your business tomorrow? Fix those first, right? I think beyond that, understanding from a prioritization perspective, what are the things that need to be fixed? What's the ease of fixing them versus the level of impact, and go for the ones that are easier to fix and have the bigger impact, right? Especially looking at people, process, technology, and I'll throw culture in there is then understanding kind of what can we do in the sort of a quick win perspective, what can we do immediately, and then how do we fix things in a more sustainable way. And so each agency is in a different place, right? And so some agencies, the tech stack is just never going to support you, right? And so then it's often the hard decision of, should we just replace our technology? It's hard to do. Gives you, it's probably the best way to future-proof your business, along with fixing your culture. For some agencies, it's good enough, and they can look at, there's tools like Now AI, can really help with scheduling, can really help with EVV, care, care path development, enrollment. So sometimes patches are appropriate and do work, right? Especially the ability to kind of give yourself more bandwidth to look at the more sort of medium and longer term items.
And Michelle, where do you see organizations successfully using technology to standardize and strengthen operations?
Yeah, I mean, I think Brent laid out the platform side really well. So, because like the agencies I see using technology most effectively, they share kind of a few things in common. I think the first most critical one is they've actually done the process work first, so that they're not kind of using technology to mask dysfunction. So I think, what looks good first, like before they try to automate it. So make sure that they're just not layering technology, kind of on top of a broken workflow. So I think kind of falling into three categories, the most consistent success stories I see is, your authorization and eligibility management tools. So agencies that have moved from spreadsheets or manual tracking to the automated authorization management, they see their claim rates just drastically improve, really meaningful. And then probably EVV with real-time exception management. So not just EVV capture, but the workflow on the back end that routes exceptions, just immediately to the right person and tracks that resolution. I think agencies that have gotten ahead of their EVV backlog have almost always invested in that exception workflow. So not just the apps the caregivers use out in the field, right? And then thirdly, just integrated billing and compliance reporting. When that payer specific requirements and documentations and standards and the claims data are all visible in one workflow rather than, working across separate systems, the compliance team and billing team kind of, start working from the same picture. They work as one. And I think that alignment alone reduces appeals and kind of the rework significantly. So what I would caution against is technology as a shortcut to compliance. So just that good platform, surfaces the risk. It doesn't automatically resolve it. You still need the trained people making good decisions, but technology just makes sure the decision gets made, at the right time.
Absolutely. And Stephanie, what kind of technology capabilities actually helped reduce risk in your experience?
Yeah, I think it comes down to probably three main points for that. Locking down the documentation we receive by only receiving what we want, being very sculpted and creative with what we ask of the standardized documentation from the caregivers, not asking more than what we want, making sure that they expand on what we need them to expand on, and then taking that documentation and reviewing it and having it kind of reviewed by AI. We use Notable with OI Care. That's been a big help for us. We've identified like 20% of IRs that otherwise wouldn't have been reported through Notable. So taking that type of information and really just kind of adapting it to your practice. And then I think not being afraid of change. We talk about change management all the time. Taking that data that we get, the documentation that we get, and the outcomes that we receive from it, and then changing the way that we look at the forms that we create and the expectations we have for everybody that's involved in it. If you go in our production environment, we probably have 17 versions of one form for each form because we'll launch, it'll go live, it'll go great. And then we'll get, some feedback, for instance, like just incorporating the intelligence. See, if we have a nurse go out and do a supervision visit and we ask, are you satisfied with your caregiver's performance? And the section is no selected, but then there's a comment box, but it's not mandatory. The nurse might not add comments in there, and I want to know why they're not satisfied. So then when they click no, I prompt them 4 more questions that they need to ask so that I can take that data and then I can do something with it. I can reduce turnover, attrition numbers. I can make sure that we're, not missing any reportables. So just really utilizing the intelligence that's built in there and then not being afraid to change things just because you've already published it.
So it's essentially coming back to some of Michelle's point about thinking about the process first and then implementing it into the technology in order to better have visibility. And Maya, finally, for you, how do you think about balancing automation and all these efficiencies with oversight and accountability?
I think really the key is that folks view the responsibility for things working well as a continuum, and making sure that everyone's clear on what role they play in the process. You hear that a lot when organizations talk about the revenue cycle and managing that, and how really it's a flow of actions and steps that have to be taken along the way. And compliance is not something that's separate and apart from those steps. It's really something that's part of each of those steps. So the more, I'm a big fan of actually compliance being more of a dispersed model where it is owned by the various players who in the operational field out there, because the key to achieving compliance is that all the steps that are taken are done correctly, and if there are difficult decisions to be made, they're made with consultation and kind of a review and vetting. And so, as Michelle mentioned, and others too, the automation and the system is not, or the technology is not going to replace any of those truths, but it can certainly help accelerate growth, accelerate progress, relieve a lot of the administrative burden, and ultimately make it easier for the organization to not just do their work, but show that they're doing it, especially as it comes to diligence processes where you're being asked to show us how you do this. And like, what is your process? You don't want to say, oh, my process is 15 people maintaining a shared spreadsheet somewhere. And only Sarah knows the answer and she's gone.
That's a very good point. But yeah, so like now let's start wrapping up as there's only 5 minutes left. Practical takeaways, rapid fire. If a provider wanted to strengthen their back office over the next 90 days, what's the first thing you'd tell them to do? Let's start with Brent.
First 90 days, it's really by prioritization. So I think it's finding what are the quick wins, like what are the big pain points and what are the quick wins that you can do to fix that. So not technology, it's really people and process. Really focusing on, is there process fidelity that's not in place? I think is one. Two is also governance. So what are the things that need to be measured, and being able to put benchmarks and measurement in place. I think that alone tends to drive some level of improvement, that people know that it's being looked at.
Nice. Stephanie.
Yeah, I would just say burnout occurs a lot in quality assurance and compliance, and the best thing you can do is, hire quick and be prepared to fill a new position when your previous one's at 70% capacity.
Michelle.
I think it's mapping the workflow before you try to fix it. So rapid fire, at the risk of sounding redundant, I'm back to that process thing. But I mean, map the real version, right? Not what you have as a policy version. So sit with the people doing the work, Ask them where they go when the system doesn't do what it's supposed to do. Ask them what the workarounds are that exist that are very real. We know it, we know they are, because in almost every agency I've worked with, there's kind of this gap between the SOP and the binder and what actually happens at 4 p.m. on a Friday when a referral comes in and there's 2 staff members out. So map the workflow before you try to fix it.
Absolutely. Maya.
Yeah, agreed on all points. I would say scope the current state, decide where you want to go, like what's your vision, and then the fun part is figuring out how to get there. That's where technology can help. But yeah, all those difficult questions and steps have to happen first.
Thank you so much for your takeaways and for your answers and participating to this roundtable. I'm opening the Q&A box as a poll will be opening. And we don't have any open questions as of now. So for the participants, don't be shy. Submit your answers and we will ask away with the 3 minutes remaining. But if there's no questions in the meantime, what I'll be sharing is if you're ready to learn more. And before we wrap up, I wanted to leave you with one more resource that can help you keep the momentum going. So on June 25th at 2 p.m., we're hosting another webinar in partnership with Home Healthcare News called How to Benchmark Your Business Health in Home-Based Care. And that session will unpack new survey findings in home-based care leaders across North America on what business health really looks like and which metrics organizations are actually using, where financial and operational pressures is hitting the hardest. And you'll also hear live reactions and perspective from industry experts on what the data means in practice. And if today's conversation resonated with you, I'd definitely encourage you to check it out. And the registration link is available in the webinar resource section. We'll also include it in our follow-up email along with today's recording slides. So with that, still no questions coming in. So in that case, thank you all for taking the time to join us today. Please take 2 minutes for the following webinar to fill out the post-webinar survey. Until next time, take care.